Hello, everyone, and welcome to Is This the Norm? Please be sure to like, subscribe, and follow us on Facebook, Instagram, Spotify, Pandora, and anywhere else you get your podcasts. And thank you so much in advance. I'm Rebecca.
And I'm Laura.
And this is Heather. And today I'm going to be talking about something that may be controversial for some. So I just kind of wanted to give the disclaimer that I'm going to be talking about the brain of pedophiles, not going to get into any specific incidents or statistics, just basically some peripheral knowledge about that and what little studies have been done. So just wanted to give that warning. So if this is not something for you, that's fine. Skip over it. We have many lighthearted, non-controversial type podcasts, but this is something I always wondered about, and so I wanted to kind of my medical brain and even my legal brain wanted to kind of know what this is all about and what we do and don't know. So first, I'll just start with the basic definition of pedophilia is defined as an ongoing sexual attraction towards pre-pubertal children. In the new DSM-5, pedophilia is depathologized, which means to cease treating a behavior, identity, or condition as a medical or psychological disorder. So pretty much this is not a curable condition where you can give a medicine. So it's not considered pathological, if that makes sense. So let's see, it does differentiate between sexual preferences regarding the age of the child, and the disorder has additional factors that it goes into. And I'll just touch on those because I could go on a podcast for 2 hours about that, and we don't have time. So I just want to get into the basics and not the nitty-gritty minutia of many factors where these really smart people in these studies I was reading, I'm like, oh my God, what are you talking about? Let's get into, tell me what your conclusion is. So it took me a while to get to some of these bigger facts. So these factors include experiencing significant distress and impairment by fantasies and urges, or the acting out on a behavioral level, including child pornography consumption and or committing hands-on what they call CSA, which is child sexual assault offenses. So there's these additional factors on levels of what pedophilia looks like. So research into the nature of pedophilia is delayed in comparison to research into other psychiatric disorders, which kind of makes sense because it's probably really hard to research these people and talk to them without just getting mad or angry or wanting to choke them right on the scene. I don't think it's something I could research. So I'm very thankful that people do want to research it to try to figure out, is this something that we can address? I have my own opinions on that, and I'm sure much people are probably yelling at me right now saying, this is what I would do. Trust me, I'm likely in that boat with you. However, with the increasing use of neuroimaging techniques such as functional and structural magnetic resonance imaging, or otherwise known as MRIs, together with neuropsychological studies, we are increasing our knowledge of predisposition and accompanying factors that contribute to pedophilia development. So there was an article I found from BBC News from this one doctor, James Cantor of the Center for Addiction and Mental Health in Toronto, Canada. He spends much of his time exploring the brains of pedophiles, sorry. They spelled it with an E because they're from Canada. Using MRI scans, he has reached a startling and controversial conclusion. He calls it that pedophilia is a sexual orientation, and he says that pedophilia is something that we are essentially born with, does not appear to change over time, and at its core to our being, as any other sexual orientation is. So I know I think the reason they say it's controversial is because they're like, you're putting him in the LGBTQI plus. And I don't think that's what he's doing. He's just saying this is something you're born with and you can't change it. And it's unfortunate. And again, I'm in that boat on what I think about people with pedophilia. It's as if in these people, this is his quotations, quote, it's as if in these people, when they perceive a child, it's triggering the sexual instincts instead of triggering the nurturing instincts, which I thought was really interesting. I didn't really find that in many other extensive studies. This was just in the article regarding his research. He also said that convicted pedophiles are 3 times more likely to be left-handed or ambidextrous than the rest of the population. and that they are significantly shorter than other convicted criminals. It must be stressed that doesn't mean short and left-handed people are significantly more likely to be pedophiles, but these are characteristics that are generally determined during the first trimester of pregnancy, suggesting pedophilia could be determined at the same time, per this Dr. Cantor. A possible cause may be maternal stress or malnourishment. So that's another controversial thing he said. A subset is that many are what we are termed as, I think it's hebephilias, where pedophiles are defined by a persistent attraction to prepubescent children, where hebephiles have a very specific attraction to pubescent children, which is aged roughly 11 to 14. The character Humber in Vladimir Nabokov's novel Lolita, have you guys ever heard that? I think it was director, the one that did Space Odyssey, 2001, Rebecca Kubrick. What's that guy's?
Oh, yeah. Oh, I can't remember.
Oh, my.
Is it Stanley?
Yes.
Stanley.
Yes.
Yep.
So he's the one that did the movie Lolita. So if you've never watched it.
And didn't he also do Clockwork Orange?
Yep. Yeah. I have
really
all
good
his.
movie.
And he also did Eyes Wide Shut, which I hate that one. That's my least favorite of all of his. And then he did Lord Byron, which is a funny one. It's comical. So there's a novel, Lolita is the most famous example of this child abuser where he gets obsessed with this young woman. And anyways, you'd have to watch the movie or read the book. Dr. Cantor says the brain of such people differ from the rest of the population in the same way as pedophiles do, but to a lesser degree. Those with a sexual interest in teenagers more often abuse girls, whereas pedophiles, clinically defined as, tend to have higher proportion of boys among their victims. And this was from another doctor, Finlatter. I think that's how you say his name. Okay, so that was just kind of some controversial things about pedophilia.
So I hate to draw this parallel because it sucks, but so we know now scientifically that homosexual people are born homosexuals. So you're saying that, I don't want to say similar because it's not similar at
It's
all
not,
to
but I get
consenting
what you're
adults.
saying.
Is
Well,
but-
we're born heterosexual, right? It's the same thing. You want to draw the
Whoa.
parallel. Heterosexual.
Sucks. That sucks. That really.
What do you mean?
Is it like a gene that you're born that way?
I'll get into that.
I
It has
had
to do
no
with
idea.
certain parts of your brain.
Ugh, that sucks.
Yeah. So these parts of our brain that I'll get into here in a moment will tell you that's why people are a certain way they are, whether they're homosexual, transsexual, heterosexual. It doesn't matter what your sexual orientation, there's certain parts of your brain that determine that. So there is a parallel to any sexuality, actually. So it's not, you're not drawing a parallel that's a bad thing. It's just how we're born.
Yeah.
And unfortunately, these pedophiles are born that.
That's why I was like, when you had said the LGBTQ plus community, I didn't see the link there. I don't know how you jumped to that.
That's where the controversy comes.
I don't get it.
Because it stated that. Or he could have just said heterosexual.
Okay, he said that.
The doctor, yeah. So
okay, because I was like, people just assume that. I would never have linked that or jumped to that immediately.
Yeah.
No, yeah, like saying pedophiles are pretty much born this
and he
way.
didn't do that. They just jumped to that conclusion.
Okay, that's what I don't understand. Like, how do they jump to that conclusion? I think
because
that's
it's
crazy.
Media, right?
It's ridiculous.
People take something and they think that it's attacking them when they're not, because he's just being a doctor and says something like very neutral,
scientific,
so to speak.
cerebral.
Yeah, and it comes out, he's attacking the LGBTQI plus. No, he's actually just saying that, in quotations, pedophilia is something that we are essentially born with. Does not appear to change over time, and it's at its core to our being as any other sexual orientation is. End quote. So any other sexual orientation.
Yeah.
Including heterosexual.
Yeah,
including
exactly.
heterosexuals.
I don't think that those quotes were offensive in any way.
No.
Even to heterosexuals.
Being a doctor and a scientist, 100%.
Yeah. Okay.
Right. So, yeah, if anybody's going to take offense to pedophilia being connected to sexual orientation, then heterosexuals can take offense to it also. Oh, you're relating me. No, it's just that part of the brain is what determines it. That's what we know. But I'm going to explain the structural differences once we get there. Okay. Sorry about that. No, those are really great. And I'm glad you said something, Rebecca. I was going to kind of get into that towards the end to explain that the parallel applies to all of us as humans and the basic concept of the brain. Okay, so there's two categories of pedophilia. So first, those who show no sexual preference disorder, but whom, for various reasons, sexually abuse children. These reasons include sexual inexperienced adolescents, mentally disabled persons, and those with antisocial disorders, or as sociopaths, or perpetrators with general traumatizing family constellations, which seek surrogate partners in children. So they just don't have the social skills to have a normal relationship. So they kind of have the mentality of a child, and that's what happens. So they have partners in children. Not appropriate, but these are the categories. These individuals are most likely diagnosed with various impulse control disorders, accounting for their engaging in CSA without a specific sexual preference for prepubescent children. The second category, which I'm going to get into deep analysis for the brain, are those who do display a sexual preference disorder, namely pedophilia, the sexual preference for prepubescent minors, and or hebephilia, which is the sexual preference for pubescent minors. Although this preference increases the risk of engaging in CSA, only about 50% of all individuals who do sexually abuse children are pedophilic, and not every pedophilic individual actually has abused children. And this is a weird percentage because I feel like opportunists. I'm hoping the people that do have this urge, the 50% that aren't doing things, are probably doing other things they shouldn't be doing also, which they get into that, the child pornography, which is illegal. And if you get caught, you get in big trouble. The other 50% of individuals that have abused children are those who do so without a sexual attraction to children, so they say. Anyways, in other words, they lack the necessary social skills to develop and maintain emotional and sexual relationships with appropriately aged persons and look to replacement partners and children as a kind of surrogate. So there's in these two groups, they both kind of have this where they can't have normal relationships with adults. Still not an excuse. So men versus women as far as pedophilia goes. Although pedophilia is generally regarded as a phenomenon in males, victim surveys show that a female perpetrator was indicated by between 14 and 24% of abused males and between 16 and 14 of females. So this is female, child male, adult female, child female. And a Dutch report investigating female sex offenders in the Netherlands between 1994 and 2005, common characteristics included intellectual impairment, a high current and/or lifetime prevalence of psychiatric or personality disorders, and a high lifetime prevalence of neglect and sexual abuse. Frequently, the abuse against a child is carried out in collaboration with a male partner, or victims are seen as surrogates to replace less than desirable relationships. So, put in simple terms, is the chicken or the egg kind of thing? Is this a brain problem, or is this something that happened for nurture versus nature, is what this study was showing with women. And then oftentimes it's a woman with another male where she's luring the child in for the man. So basically that's what they came up with. Currently, there's no reliable estimate of pedophilia in women, and the question remains whether pedophilia, as currently defined, even exists in women. I would assume yes, it does. There's just not enough studies. So the epidemiology, which is what happens, how does it look, what can we say that these traits that these pedophilias have, not in the structural brain, but overall, what does it look like? So pedophilia does not always occur in isolation. Men with pedophilia often have extensive histories of psychiatric disorders, much like women that they studied did. And extremes cases can overshadow discovery of these other disorders. The pedophilia kind of gets clouds over anything else, whether this is a secondary phenomenon that relates to emotional and social consequences of this, or whether these are comorbidities, kind of is unanswered, in other words. So again, somebody has pedophilia and they miss all these other disorders. So it's if they could treat these other disorders, maybe that will help with the pedophilia issue. Again, because these individuals are not studied, it's kind of hard to say. So a relationship has been identified between the pedophilia and comorbid psychiatric disorders among pedophiles in residential or outpatient treatment. 2/3 had a lifetime history of mood or anxiety disorders. And then 60% had lifetime substance abuse history, with 51% naming alcohol as their drug of choice and 60% qualified for personality disorder, obsessive compulsive disorder, antisocial, narcissistic, avoidant behaviors, so on and so forth. So general dysfunction, they overall have a lower IQ, high frequency of left-handedness, what I talked about, low levels of academic achievement, and lower job capacity. Specific cognitive deficits that they have is verbal word fluency, verbal and spatial working memory, emotion recognition and empathy, attention issues, and just low executive functioning. So those are some kind of basic, again, just because somebody has this doesn't mean they're always a pedophilia. Some people have these issues and are not a pedophile. So brain 101, before I get into the structural, because if I start talking about the structure of the brain, you're going to be like, what does that even do? So some of the structural issues in pedophilia is a frontal lobe. So what does the frontal lobe do? It manages complex mental tasks like problem solving and reasoning and organization and long-term planning. It also governs impulse control, social appropriate behaviors, empathy, and motivation. It determines how you manage and react to various emotions. It also helps with speech, memory, and motor control. And then the right temporal lobe. So you got right and left. So specific to pedophilia, we're going to talk about the right temporal lobe. And that contains structures like the hippocampus, which encode new short-term memories and consolidate them into long-term memories, acts as the brain's processing and filing center. It's primarily responsible for hearing, interpreting language, recognizing face and objects, and forming and retrieving memories. It interacts with the limbic system to regulate emotional responses such as fear, appetite, and sexual desire. So you can kind of see where each of these structures are feeding into the problems. And then another part of the internal part of the temporal lobe is the temporal horn, which processes nonverbal memories, auditory information, and visual perception. And I'll get into this is more like not the temporal horn being problematic in pedophilia is not really because it causes something specific to what they do, but it just is a symptom that they see in the brain. So then you have the amygdala, and it's an almond-shaped structure in the brain, or almond-shaped structures in the brain's temporal lobe. As a core component of the limbic system, its primary function is emotional, fear, fight or flight. It decides whether something is threatening or not, and basic survival-based behaviors. And it works closely with the hippocampus to attach emotional significance to memories. This is why emotionally charged events, both traumatic and joyful, are often more vivid and easily recalled than mundane ones. So like those core memories you have, that's part of your amygdala and hippocampus working together. Dictates appropriate social behavior. Hyperactivity of the amygdala is strongly linked to anxiety disorders, phobias, depression, PTSD. Conversely, damage to or removal of the amygdala can result in a loss of the natural fear response, leading to impaired judgment and dangerous risk-taking behavior. And then finally, the hippocampus is a complex seahorse-shaped structure located deep within the brain's temporal lobe. It serves as the brain's primary processing center, again, for memory, and then spatial navigation, which is a fancy way of saying our internal GPS. I think Rebecca and I's is broken.
Ours is definitely broken.
I had to put that in there. I was like, oh no, my spatial navigation is so terrible.
It's bad. It's underformed in us. Absolutely.
I don't know what happened. I just remember that one time we got lost going to a funeral, which is terrible to be late to a funeral.
Oh my gosh, seriously.
And this is how old we are. This is before your phone had GPS. This is where you still had to print out maps to get somewhere.
Yeah, and Heather was like, I know how to get there. She did not know how to get there.
I did not. I've now accepted my inability. My GPS, internal GPS is terrible, and I depend heavily on my phone. Now, if I've lived somewhere for a while, I'm good. Then it's going processing in my long-term memory. So anyways, so I just had to have that little side joke about Rebecca and I. Specifically, this hippocampus is responsible, like I said, it converts the short-term to long-term, and it builds these mental maps to navigate the world. So Rebecca and I, we have to actually experience the navigation to hopefully remember it. I would say I have to experience it multiple times.
We got some workarounds.
Yeah, memorization. It plays a role in conditions like major depression, schizophrenia, and PTSD. This part is affected by Alzheimer's and other forms of dementia. I don't know if I really knew that as a nurse, that it specifically affected that part. Maybe I did. I don't remember. And then, of course, I plan to put a picture of the brain. I found a really good one that kind of explains the limbic versus the cortex parts of the brain, which is the frontal, parietal, and occipital. So getting on to brain structure differences in these areas that I just kind of give you the one. So anyways, so these, just so you know, as a disclaimer, these studies are inconsistent and unreliable at best. However, studies of the brains of these individuals show that patients with lesions of the anterior temporal lobe and frontal lobe show changes in their sexual behavior. So these are just basic people that end up with lesions like cancers or what have you. For men, it's also been shown that men and women differentially recruit hypothalamic and amygdala regions, reflecting the dependence of sex-specific sexual behavior on these neural structures. So pretty much that the way that men and women think about sex is completely different. And the critical role of the amygdala
Oh,
and brain.
wow.
Yeah,
Surprise.
I know.
Yeah, I would have
Wow,
never
that's
guessed that.
revelational.
It is not. I know. That's why I was kind of like, duh. And then the critical role of the amygdala in the framing of sexual behavior has only been confirmed in studies for animals, demonstrating that sexual behavior can be altered by stimulation, as well as lesions made by the medial amygdala in a manner depending on previous sexual experience. So, again, like I said, these are studies in animals, like their sexual preferences at a much different and lower level than humans. So I thought that was interesting. Okay, so they did these MRI studies. Let's get to these individuals. And again, this is a very small study. So they did MRI studies of 15 incarcerated male offenders, which were of younger children, or just children. I shouldn't say younger, just children. So they noticed a reduction in brain tissue to the lobes, which is the frontal and anterior temporal lobe, among other areas that are too complex that I'm not going to get into. So first, with the frontal lobe, the white matter connecting the frontal lobe to the temporal lobe, they had severe microstructural alterations. So this suggests that a potential communication breakdown between the brain's emotional centers and its executive control centers. So like the frontal and the temporal lobe, there's some microstructural alterations that are affecting that communication center. So the frontal lobe activity is thought to cause a deficit in sexual impulse regulation, so meaning they can't control these impulses as much because of the decreased tissue and communication issues. Rather than the frontal lobe creating the preference, its reduced regulatory function may impair the person's ability to inhibit or redirect deviant sexual impulses. So I kind of had a problem with that statement just because it's like saying that, oh, everybody has these impulses. It's just that people that engage in CSA just can't control those
Yeah,
pulses. Eh,
I don't see that. I don't know.
yeah, I think that there's
Seems
impulse control issues that everybody may have. These guys in particular have impulse control issues with these thoughts that they shouldn't have,
yeah,
right?
like maybe it's hand in hand type of thing.
So I think a lot of people have impulse issues that doesn't ending up them being a pedophile. So I was like, I didn't really like that statement, but that's the research I had. Caveat, there are documented medical cases where adults with no prior history of pedophilia interests suddenly develop it following a brain tumor, stroke, or traumatic brain injury to the basal frontal temporal network. So again, it can trigger that. Was it already there? Maybe. And they were controlling the impulse? I don't know. So there you have it. Anyways, these cases where there's a structural documented tumor, stroke, or traumatic brain injury, these cases typically present with global frontal orbital dysfunction, meaning mostly in the frontal cortex, resulting in severe personality changes, extreme sexual disinhibition, meaning can't control their impulses, and a general loss of impulse control across both sexual and non-sexual behaviors. So again, I think that the damage can lead to all kinds of things versus these people that are born with it, right? So let's get into the right temporal lobe, where there's reduction in white and gray matter. This alters their brain emotionally and sexually. They can't process. Again, it's the frontal and temporal lobe are both kind of related. The right temporal lobe, that is. The structure is different in development, and it alters their sexual interest and behavior control mechanisms. Now, the right anterior temporal horn enlargement, which is the deeper, it's a fluid-filled cavity deep inside the right side of the brain where the temporal lobe is, partially formed by the hippocampus. So there's a reduction in the gray and white matter volume of the right temporal lobe, which alters the brain's networking. And they see this only in these pedophiles, is that the widening of the horn is often visible on the tissue in the lobe. So you'll see this little horn structure and it's just expanded. So it's just, I don't know if I'm explaining this right. So what happens is this horn that's widened, it doesn't have anything to do with the functioning. It's a symptom of the right temporal lobe issues that I'm talking about. Does that make sense?
It's a marker.
Yeah, it's just a marker. That's a good way to put it.
Okay, that's happening. That explains this.
Exactly. And this MRI picture I saw, they had what they call normal brains to the right, and then on the left was all these men that were incarcerated, and they all had this area where you can see the black dot where it's this expansion that's only in their brains. And then they also have cerebral spinal fluid space enlargement, which is also the ventricles in sociopaths. Like I've told you this, Rebecca, those are bigger too. So it's the similar thing, like these larger areas that are expanded that don't really cause the sociopathy, but it's just a marker. So same here as the cerebral spinal fluid spaces, they have enlargement there. And then the amygdala, which is deep in the brain, that's that little almond structure I was telling you about. The right-sided ventricular enlargement is observed. Oh, you know what? That's what I'm talking about when I saw this MRI. It made me think of the sociopath's brain MRIs. So not the temporal horn enlargement can be seen, but the one I was looking at was showing this right ventricle enlargement that it's observed as black little area in each brain. So the gray matter in the amygdala showed significant deficits in these individuals, and it's unilaterally present on the right side in the septal region. So it's very specific to this right side of the brain. That's why you keep hearing me say the right side. So basically, the conclusion is that perpetrators had a significantly smaller amygdala volume right on the right side and was not age dependent or progressive, and thus does not appear to reflect classical, degenerative process. So meaning these individuals were all kind of different ages, so it wasn't a degenerative issue. It was they were born this way. It might be better explained by developmental disorders or pre-existent hypoplasia. Okay. It's specific to these individuals. Lower right amygdala volume also correlated with the enlargement of the temporal horn, which I was telling you about, which was recognizable in the majority of the perpetrators, even by mere routine inspection of the MRI imaging scans. So just a basic MRI could show it. They didn't have to do any light up, or you hear about MRIs where they give you a certain substance to light up that area. They didn't have to even do it. It was just a routine inspection. They see it. So earlier studies in humans indicated that temporal lobe lesions affect sexual function more frequently with right side than left-sided damage. So even when you get damage, like say you're not born a pedophile, you get damage later in life to the left, it doesn't show any sexual dysfunction. It's only the right side. Go ahead.
Sorry, it just popped into my head the thought whether the reason I bring this up is because I myself am left-handed, and people always are surprised. Oh my gosh, I didn't know you're left-handed. So yes, my whole life in my right brain. So I wonder, is that true? If you're left-handed, you use the right side of your brain more, or right-handed, you use the left side of your brain more. Maybe that's the connection of why so many of these people are left-handed, because it affects the right side of your brain so much.
Possibly. Yeah, I didn't get into that too much. That's very, very
because you're not left-handed. It matters to us lefties.
I know.
This is important
That's why I wanted
stuff.
to make the disclaimer. Just because you're left-handed doesn't mean you're a pedophile.
Thank you. Thank you. Don't come for me.
Yeah.
I have the nurturing effect towards children. Thank you. Only nurturing.
And you're a woman, so The studies are
So I'm
still,
better than
jury's
men.
still out on women on really what we are. But you hear about these women teachers that are having,
Yes, that's exactly where I
and I'm
went to.
like,
These nasty teachers that go after these
yeah,
boys. They groom them. So
right.
disgusting.
And that tells me that there's pedophilia in women. That's kind of
I think
kind
so.
of the caveat. I'm not protecting any women as a
Yeah.
whole race. If you do those things, not okay.
Exactly. No, all jokes
Period.
aside, yes, women very much participate. But we were specifically talking about pedophiles, which sounds like well before pubescent. And it seems as though these teachers are more towards the, what did you call it? Herpopedophile? Or what was it? That started with H?
Pedophilia, I think, is what I'm.
Hepaphilia. I think the female teachers
HEBE.
are more towards that age
Yeah.
group. It's like 5th grade and beyond, which is still gross.
Still not
but
okay.
Yeah. Yuck. Okay, put them in jail.
Put them in jail. It's not okay at any age. Sorry, Marley's slapping around in the background. So yeah, that's what I'm saying is I don't want anybody getting mad at me because you're left-handed. Because most people I know that are left-handed are very creative, and you are creative, Laura. And Grandpa was left-handed. He's creative. I always forget, is Kira left-handed?
Yep.
Yeah, and she's very creative too. She's very artistic. There's really great things that come out of using that side of your brain more.
We got a lot of lefties in our family.
Yeah. I don't, yeah.
But there's just a clear distinction between using that side of your brain more and that side of your brain being all jacked up. So there's the discrepancy, I think.
Boring people with this brain part of, you guys might have been checking out, but if you look at the pictures, it's interesting because I never knew the amygdala was so vital. It was very vital. I always know any part of the brain is vital, including the frontal cortex, because that's personality and all that stuff, but that it had so much to do with sex. And probably because I went to nursing school when it's still very conservative and it's the US, we come from a Puritan society. So talking about sex is so bad. So anyways, yeah. So these lesions that could happen to people that are more in this way. I know that's a weird term to say. And sometimes enhance the libido, while left-sided ones tend to impair it, meaning you just have lower libido. Taken in this context, the results suggest that pedophilia might be accompanied by hypersexuality, a possibility that should be addressed by future studies. So not only do they favor kids, which is bad, they're hypersexual about it too. So they got these two urges that are really strong, that are hard to control. At this point, a dysfunction of the medial amygdala and related structures might also, there's something going on that it interfered with the sexual maturity of the individual, meaning because it didn't develop right, or there's wiring that's not right between the amygdala and the hippocampus and the temporal lobe, that they don't sexually mature. So that could be part of the problem, leaving the individual without normal sexual responses that are crucial for maturing as you get older with your sexual behavior. Again, this could be it. This could be why, but they don't really know, other than structurally what they saw different in these individuals. So just a side note, I've always said, the Spartan way, after you get a scan of the brain, push them off a cliff, right? The problem is that some people have these abnormalities in their brain, and it's not homogeneous. Homogeneous? Am I saying that right? Homogeneous. There, I knew I was saying it wrong. Meaning that these differences in the brain is not just only in people with pedophilia. These brain abnormalities can be in other individuals, meaning that there's no other deficits or issues. They don't display pedophilic tendencies. And again, not everyone with pedophilic tendencies display visible frontal lobe damage. Does that make sense?
Yeah.
So it's not a indicative thing of pedophilia.
Just because you got it. It's the same thing as brain scans of people that are psychopaths match brains of people that are just totally normal. So just because they have these markers or traits in their brain doesn't necessarily mean that they're going to act in a deviant manner.
Correct. Yeah.
Yeah, so it makes me think of the movie Minority Report with Tom Cruise.
Right.
Yeah, so you can't just make assumptions and then put people in prison. But if they are caught in the act, I say shove them down that Spartan hole right away.
Yeah, that's what I was going to say.
Push them off the cliff, Flora. You got to shove them off the cliff.
I guess I just think of that movie with what's his name's Leonidas, the main character. I thought it was like a big pit. The messenger comes and he gives him a bad message and he puts him down this pit.
No,
So it
it's a
wasn't very
cliff.
nice.
Deformed children are
Yeah,
thrown off the cliff.
like the real story. Yeah,
It's
so sad.
so bad.
Hurts my heart.
I'd rather like the fact that they're seeing it in the womb. I was like, but again, even if they have the abnormalities that are showing in the womb, doesn't mean you can go in there and fix it and they won't have the problem. So it's sad that there's
It's
not
not
an
the
answer.
solution. We can't scan everybody and say, oh, you're a pedophile. Bye.
Yeah, right.
Yeah.
So notwithstanding this important study, this is also observed in patients with Urbach-Withy syndrome. I'm probably saying that completely wrong. It's a rare disease leading to bilateral amygdala destruction and have not revealed any overt propensity to pedophilia in these individuals either. So again, not everything that these structural issues lead to pedophilia. But there is a lot of programs out there. I'm only specifically talking to one I know about in Washington State. It's known as SOTAP, which is the Sex Offense Treatment and Assessment Programs. In Washington State, it's through the DOC, which is Department of Corrections. I'm going to talk about that. So that's a tendency of a convicted criminal to relapse into criminal behavior and reoffend. So a study was released in April of 2023 by SOTAP. Beginning in October 2018, a new treatment program was implemented at SOTAP in Washington, giving rise to the current intention to examine participant outcomes and determine if there were measurable improvements compared to the outcomes of participants that were in the old or the original treatment program. So in total, only 4 of the 191 people, 2.1%, who participated in the new SOTAP program were readmitted to prison for committing a new offense, which sucks because any new offense at all is terrible. Of the 674 people who participated in the original SOTAP program, 50 people, which is 7.4%, were readmitted to prison for committing a new offense. So I thought that was good to hear that the percentage went down quite a bit with this new program. I'm not going to get into what the new program is in like little nitty gritties, but Washington State treats approximately 360 individuals annually in prison facilities and 420 in the community. The institutional components are available at 3 different prisons, which is Airway Heights, which is here in Spokane, Monroe Correctional Facility. I guess it's only 2 that I saw. There might be more by now, followed by a mandatory 12-month outpatient community phase. So what made me think of SOTAP is I actually had a client that worked at SOTAP. And some of the stories she told me, I'm like, I don't know how you did it, because she was a mom. And when she worked there, she was pregnant. She had told me some stories. But it's hard because people don't want to fund these programs. We don't want to help these sex offenders, but you got to look at it in the fact of somebody's got to watch them. We got to do something about it. We can't throw them off a cliff. So we might as well have a program that gives them treatment to hope that they don't reoffend, right? So I know that's controversial, and if you don't agree with that, I totally get why. But my thought is I'd rather have somebody watching them and giving them some type of treatment in hopes that they don't reoffend to protect our children. I don't know what your thoughts are on that.
I don't look at it as helping the offender. I look at it as helping future victims.
Yeah, that's my thoughts too. It's just hard. But I get the controversy behind funding it. I just would hope that if you do feel bad, let's just throw away the key and lock them up. I get it. But at the same time, if there is success, them being reincorporated into society, they all are going to be on the list forever. They're watched very heavily. If they even slightly don't follow the rules, they are back in prison. And I only know this talking to my former client of how strict it is. And a lot of them don't. They start to exhibit certain behaviors and they kick them out of the program. It's not like you don't get to just be in the SOTAP program because you're an offender. You have to meet a lot of criteria. It's super strict. And some people, it's just like they're not fixable. You do pretty much have to lock them up and throw away the key. They can't go back into society. But even these ones that are not fixable, like once they serve their sentence, like they have to be let back out. They're still monitored, I'm sure, and they're still on the offender list. But it's like even these ones, like how many of them try to get into the program or just don't meet the criteria, but still are let out back into society? That's the scary thing too, that we have to think about.
What are these arbitrary sentences for these people? Like, how do we come up with if you abuse a child, you get this many years?
Doesn't fix them.
No, it doesn't help anything.
And they usually get, I don't know about nowadays, but we've all listened to true crime, and they do all these terrible offenses, like even to adult women and males, where they were in the act of killing them, but somehow the victim got away, and, you know, they go to the police and this person gets convicted and serves time, and then they get out, and guess what they do? They make sure they follow through the next round, right?
Because it
They
was
kill the
quote unquote
victim.
attempted murder rather than
Mhm.
actual murder. Very
Right.
arbitrary. Like, how about you put these people in prison, and until they can show some kind of change or go through some kind of program, then they stay. You're not going to
Right.
just be fixed in prison among
No.
other prisoners for any allotted amount of time without any kind of intervention. Something
Right.
has to change. You don't just sit. There has to be a
Mhm.
change.
I know there's one story, and I don't remember how I know this story, but there was an individual, I think they were at Airway Heights, that he was about to get out. And I think that, I believe this individual had molested his own daughter or stepdaughter, something like that. I want to say his own daughter, and that's why it sticks in my head. And he was about to get out. And I don't think he was going to reintegrate with the family, obviously, but they were able to intercept a letter somehow. And I think this was thanks to SOTAP being monitoring these individuals, even if they aren't treating them very heavily. And they found that letter, and it was like I don't know if it was a week or a day before he was going to get out. And because I'm sure he was going to be out on, which is Department of Corrections monitoring. And before he even got out, he'd already committed a violation. So luckily he stayed in prison because he was writing his daughter and making a plan to see her. It had some bad stuff in the letter. So that's your prime example.
So the SOTAP that you're talking about, that's like cognitive behavioral therapy, right? They're basically trying to, have them participate in therapy so that they don't do it again.
I don't know if it's specifically CBT. I didn't get into that, which is the cognitive behavioral therapy, but it probably something to that extent. I'm sure my client had told me what they exactly do.
It probably is, because it's not, because I was just curious, because I don't know if you've heard of chemical castration before, but it's basically you take drugs so that you have no libido type of thing.
Yeah, but I thought that didn't work. I thought that because there's still though they don't have a libido, they can still offend.
They have to take the drugs. So if they don't take the drugs, then it doesn't work. There's only 9 states, and Washington is not one of them, that chemical or surgical castration, they say. I've never heard of that before. I've heard of, I was listening to some podcast, and some guy that had raped, he wasn't a pedophile, he was a rapist though, and they basically offered him surgical castration and a very short sentence or life. I can't remember the outcome, but it's a thing. There's some states out there.
I remember a story about that too.
Yeah, that have chemical and surgical castration, like Alabama, California, Florida, Georgia, Iowa, Louisiana, Montana, Oregon, Texas, and Wisconsin.
Yeah. Yeah, I've heard that too, but I know the reason some states don't do it. I'm not saying this is for sure. This is just top of my brain, read it somewhere, didn't research this, so I could be very wrong, so disclaimer. That even if you do those things, it's much like a lot of times, I'm sure you guys have listened to true crime podcasts or watched documentaries where a lot of these men, I can't say for sure for pedophilia, but these men that rape or don't rape but kill, like very morbidly kill them and all kinds of weird, because they're impotent. So they're impotent, they're not having the offense, and so therefore it's not about castration. It doesn't stop the fantasy or the desire, because the wires get crossed where the sexual desire becomes something different.
It's
not
violent. Violence.
It's a violent
is,
desire.
No, these are sex offenders. The castration is specifically for sex offenders, whether it's it doesn't have to be pedophiles. It's also, men that rape.
What I'd like to know is, doing this chemical castration or actual physical, does it, I doubt it's studied because it would be really scary, but maybe it is, but putting them out in the community, what are the chances they don't reoffend based on those things? Is it different than the people that aren't? I'd have to see proof that this chemical or physical castration actually leads to them not offending again.
And I find it difficult to believe that many men would be willing to partake. So the pool of people that have actually done it, I'm sure, is very low.
Extremely.
So how could they really have any kind of numbers to say whether or not it is effective or not?
Yeah, and the nail on the head is they have to be willing to take the drugs. You can't make, you know what I mean? And so a lot of them stop taking it. I know that's happened because I've read articles about that. So
I'm going to be on both sides, because that's what I like to do, is argue both sides. Is that I know I was doing some of the research and I didn't want to get into it because it's been a really long podcast, which it's already kind of long. But anyhow, that they also noted the hormonal issues with the gonadal hormones, which is for the maturing male organs, the penis and the testicles, and that there were issues with that in pedophiles. So maybe the chemical thing for castration would work because they already have imbalance issues with that.
I think chemical castration works if they take the drugs. You have to, it's a daily thing that you have to take it every day for it to work.
I feel like, why wouldn't that be required in Washington? Rights.
Yeah.
Because like you said,
you lose do things like that, I feel.
Like you had said before, like men who are impotent, like just naturally, like when men get older and some of them have trouble with that, even though they're not feeling that desire in their brain, they're like, I want to be that. So then they get drugs to help them with that, to be intimate, because there's this desire beyond just like that urge, sexual urge, right? So even if they have this chemical castration, does that necessarily fix the problem to its
desire? Probably comes down to whether they want to be fixed or not, as with any other
that too.
type of therapy.
I'm assuming they'd have to have, obviously some counseling on top of, obviously there's so many variables to consider.
I think it is an issue in most places, because are we going to run into the same thing with the death penalty? We're killing innocent people. Are we getting off body parts of innocent people? You just never know. So that's probably why that's not a thing, because cruel and unusual punishment and all.
Yeah.
Although I don't think it's cruel and unusual punishment if it's a repetitive pedophile. That'd be a prime candidate in my book. But again, we are relying on our justice system, and we've all seen documentaries like Making of a Murderer, where can we trust them 100%? Absolutely not. To get it right.
And plus, I don't want to have to wait for someone to repetitively do this. Like, we've got to stop. We got to break the chain much earlier, right? So there's got to be a better solution.
One time is too many. Yeah, exactly.
Yeah, for sure.
Yeah, so that's kind of what the podcast is about, is it has to happen before we know, which sucks. Unless somebody comes forward and wants to get help and wants to admit they have this urge, which probably not going to happen. Very rare that an individual is going to come forward before they've committed a crime and say, I have this problem, help me. We'd hope that would happen, but it does, but it's rare from what I researched. So
yeah, I bet.
Right. So this is a very depressing podcast because, we can talk about
Heather.
This. I told you it was not going to be. But the structural differences, I just thought that was very interesting because I didn't know that.
Yeah.
I didn't know that. And I always wondered what it was different. How was it different and why?
Right. It's just one more thing, man. And things that go wrong with your frontal lobe, things go really wrong.
Yeah. And I'm proud of the DSM-5 to be saying, like, no, this is not curable.
Yeah, because we know everything that you brought up is logical. It makes sense. It sucks, but it does make sense.
Yeah. There was a recent story of an offender who had gotten out, and he obviously had to go back because it was in a parking lot, saw a very young girl, and he put his arms around her waist, and that's as far as it went, but that was enough to break his parole or whatever you call it. But he said, I couldn't not do it. I had to. So that
impulse
urge is
control
there.
issues. They have severe impulse control issues, they've noted.
But also I'd like to
which sucks.
also say, like you were saying earlier, these people are highly monitored. And so it was even just quote unquote something that small. I don't want to undermine how that made that person feel. I'm sure it's traumatizing and scary. Thankfully, it didn't go any further, but something like that was enough to put him away, that it didn't have to be something to go further.
That's what the scary thing is, that even though they've served, they also with these brain, sorry, this is just stuff that's popping into my head that I read about, is like, it's much like this sociopath, like taking things away from them doesn't change them. Like, you can tell them you're going to serve 15 years in prison if you do this again. Like, the impulse is so strong, that kind of stuff doesn't even overcome it.
Just look at it in terms of, if you had told me that I could no longer be a heterosexual and that being a heterosexual was wrong, I couldn't just change that. I couldn't just all of a sudden not be attracted to men my age.
But
right?
there's
So
yeah. But I think we have impulse. I think it's not just changing your attraction.
Yeah, true. Because I don't sit there and want to
rape men,
go after every good-looking man that I see.
And where it's like, that's a man that's heterosexual that rapes and kills women. It's the impulse issue. He's attracted to women, but he can't control his impulses to cross the wires that violence enhances his sexual desires or whatever. Which is much more complex than that, by all means. If we've all watched Mindhunter and done our research, like, it's way more complex than they're doing it to urge a sexual desire. There's also things that they hate women for, their mother for. They have mommy issues and so on and so forth.
I know. I always think about Ed Kemper and his. Yeah.
That guy's the guy that plays him in Mindhunters is exceptional.
I love him. Love
He
that
is
actor. I can't remember,
amazing.
but anytime he's in anything, he's phenomenal.
I know. And he's just this huge. If you look at pictures of Ed Kemper, you're like, oh my God, that's spot on. That's really creepy. And if you did act like that.
When he's in the hospital room and he doesn't have the chains on, you're like,
oh my gosh. And he hugs him. He's so big.
He was so big. Yeah.
So big. And I was like, he looks like a nice guy. I can see why he got away with.
He was a nice guy.
Yeah. Just had impulse control issues, apparently.
He could.
Yeah, the shoes. I thought that was always interesting. Is that him? The shoe guy? Is he the shoe guy?
I don't think so.
Oh, I'm getting him confused with another person in the Mindhunter. Yeah. Yeah.
I'm sure it's more than just Mindhunters. We all listen to different podcasts and all the movies Mom watched.
No, I know.
It's hard to keep track of it all.
Yeah, I'm crossing serial killers. Sorry, everybody. People are like, no, it's this guy that had the obsession with shoes. Sorry. Yeah, it's a different guy because he had a family and Ed Kemper didn't have a family. So getting him confused. But yeah, it's depressing.
Did have his mom.
Then he didn't.
And then he didn't.
He didn't. Okay. Yeah, that's one way of putting it. He
Much
killed
worse
her.
than that.
He killed her.
He killed her and did terrible things to her in her head.
Anyway,
getting off track.
Good show. Good episode, Heather.
And I hope it wasn't too boring. I feel like I was giving a lot of blah, 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 but
no, anyways. I don't think so. I liked it. Good job.
Yeah, no, I think it's very interesting, and I think it helps people see the whole picture of all of it, because yes, it's very easy to be like, lock them up, put a bullet in their head, hang them, get out the noose. But it's so much more complex than that when you really think of it as dealing with it as a society.
Right. Yeah. Anything I'm saying like, oh, they're born with it, I'm not excusing anything at all, because
100%.
That is just a cop out. 100% cop out. And then a lot of these pedophiles, the ones that are so severe that, like couldn't, SOTAP, for instance, in Washington, couldn't help them. They don't care. They have these comorbidities where they are also narcissistic, sociopath, like they don't care. They're going to keep doing it and they don't care. Anyways, yeah. Well, thank you for joining us. We always will have a as we call it in other episodes or other podcasts I've heard, is a palate cleanser. So I'll let Rebecca, let's make sure our next one is maybe a little bit more upbeat than this.
It will be. It's not going to be anything along these lines. So.
Okay, good. All right. Thanks for joining. Bye.
Bye.
Bye.